Good afternoon, everybody. Thank you for joining me here on the Fox 61 Facebook page for this special edition of You Ask, We Answer. We know you have a lot of questions and concerns about the COVID-19 vaccines that are rolling out more and more every day. So we brought in the experts from Trinity Health of New England. They've been such a great partner to us all these years, and happy to have two doctors who have joined us a lot in the past again today. First, Dr. Syed Hussain, the Chief Clinical Officer of Trinity Health of New England, as well as Dr. Jessica Abrantes-Figueiredo, who is the Chief of Infectious Disease at St. Francis Hospital. Thank you both so much for being here. How are you both doing today?
We're great. Thank you for having us.
Thank you.
Okay, good. Yes, and thank you for taking the time. Hopefully we can get into a little more detail than television usually allows because we're here on Facebook Live. And before we get to a lot of the viewer questions, I want to start sort of right back at the beginning. That these vaccines came out this early at all seems like it's a minor miracle. It was just yesterday on the 20th that we've seen exactly 1 year since the first confirmed case of COVID-19 was found in the United States in Washington State. And we kind of had to just treat as we went. There was so little we knew about the virus, but we had to act now. Why don't we start with you, Dr. Hussain? Did you ever think we would be able to have a vaccine this quickly?
This has been absolutely tremendous. And it's actually a testament to the advances in modern medicine, Tim. But a few things I'd like to remind viewers, though, that gave us really a bit of a head start in this pandemic. Exactly 1 year ago, in January 2020, we were able to get genetic material of this virus, a genome it's called, the sequencing of the virus, which really enabled scientists to start working ASAP on trying to get a vaccine out. The other thing is the messenger RNA technology that is now being used by both Pfizer and Moderna actually has been studied for over 2 decades by the NIH and others. So there's a lot of research that has been going on behind the scenes. Granted, the technology has never been used before, but all of that helped us. And then one other important point is the current coronavirus is very similar in terms of structure. It belongs to the same family as 2 previous epidemics that we've been through, and that includes SARS about 20 years ago that originated in Asia, and then MERS, the Middle Eastern Respiratory Syncytial Virus in the Middle East, which is mostly found in camels. And so the mRNA technology was being studied for MERS in the past, but then, MERS subsided, so it was never deployed. But one other thing I'd like to point out is vaccine development usually takes 10 to 15 years, no doubt. It's a very long, drawn-out process. Now, the points that I just mentioned helped in order to reduce that time, especially the lab time, especially time that scientists usually experiment in animals, for instance. It can take up to 4 or 5 years. So that time was compressed. And then what we also did, clinical trials, this can last up to 7 years. We did this in a matter of a few months. How? By doing various phases of the trials, phase 1, 2, and 3, more combined and in parallel. And one other thing, one important point, the third point, is manufacturing. So we ramped up manufacturing of these vaccines thanks to Operation Warp Speed and the support from the federal government, so that even before the results were out, we would have doses. Now, that's a risk, obviously, because if the results didn't pan out the way they did, then those doses would be wasted. But it's a risk we took. And all of that led to this compressed time frame.
It sounds like just a lot of the steps that used to be made in sequence were being made, like you said, simultaneously at the risk of hundreds and hundreds of millions of dollars. But boy, did those risks pay off. And it's a lot to do with just the genius of the mRNA vaccine. Like you said, Dr. Hussain, this is the first time we've sort of seen it. Now, I think the layperson doesn't always have a great understanding of how vaccines work. So why don't you just start by telling us how past vaccines tend to work, and then therefore what makes mRNA vaccines different?
Sure. So the concept for every vaccine is similar. It's to trigger the immune system so that it recognizes if the person gets infected with the real virus. So for instance, here in this case, the messenger RNA is injected, and then it has a very specific instruction. And basically it's like a recipe. Basically, it's telling the body, build the spike protein. The spike protein is the same spike protein that is present on the surface of the coronavirus. So then the immune system of the body says, hey, wait a minute, you don't look like you're local. We're going to attack you. So then they start attacking the spike protein. That leads to antibody development. So once the person has been vaccinated, which means 2 doses, and they've developed immunity, if they come down with the real coronavirus, then the body will be like, okay, I know this virus because of the vaccine. And that's when the antibodies and the immune system will react.
And what I want to try to do is figure out if I've got sort of, again, the layperson's understanding of this. With previous vaccines and a lot of standard vaccines, they'd either give you a dead version of the vaccine or, I'm sorry, a dead version of the virus or just a part of the virus. But either way, it's something coming from outside the body that your body's immune system then recognizes as an intruder and fights. But in this case, your body is the thing that's also making the spike protein. So both the reaction and the thing to which it's reacting are coming from you, only you, nothing from the outside of the instructions that is the mRNA. Is that sort of breaking it down correctly?
Yes, absolutely. That's spot on. There's no live virus with either Pfizer or the Moderna vaccine.
To me, this shouldn't work. I mean, it seems like the human body is very good at being able to tell what's from inside and outside the body, outside, of course, autoimmune disorders where the body is confused and thinks something from inside the body is an intruder. Why did we have a reason to believe this was going to work in the first place, just this type of approach?
It's a novel approach. It's again, it's a testament to the developments we've had in modern medicine. We probably wouldn't have thought about this if this was 3-4 decades ago, but it's been studied and it works. And the amazing thing about this technology is that it's also degraded very quickly by the body. This was one reason why it took so long for us to find a vaccine that actually worked with mRNA technology, because it gets degraded very quickly by the body.
Yes. Dr. Abrantes-Figueiredo, thank you for being so patient while we started with Dr. Hussain. I want to get over to you now. We've talked about how wonderfully effective this vaccine is, but didn't have to be as effective for such a wide population as it turned out to be. So at this point, who do we know the vaccine is safe for, and who might still want to hold off on getting it?
So right now, really, there's very minimal contraindications in getting the vaccine, and that's really just if you have an allergic reaction to a specific component in the COVID vaccine. What people need to understand is that as much as this might be a novel approach in vaccinating, we already know so much about COVID-19 and the folks that it can infect and the diseases that can also cause people to have very severe disease. So it's actually important that really there's minimal contraindications, like I mentioned, and in all subgroups, even if they weren't studied, a lot of the social societies are coming out with recommendations that their patients should still be offered the vaccine, especially if it's their turn to get vaccinated. And they do fall into those risk categories where, again, it would be their turn in line to get the vaccine.
We've gotten a lot of questions to that effect. What about pregnant women? To what degree has this been studied on pregnant women?
So unfortunately, the studies didn't include pregnant women, so they were excluded. That being said, there were a small number, but a number of women who did get pregnant in the trials as well. And then they get studied further and going forward as well. What we do know about the vaccine is just how safe it is, in the population that they studied. The other thing is just the technology and the science of it. There's very few, if any, vaccines that are contraindicated in pregnancy, and usually those are just the live virus vaccines, which this is not. The other thing, especially in pregnant women, is we know what COVID-19 can do, the infection in pregnancy, and we've seen severe disease. They could also be at risk for premature delivery as well, so obviously fetal issues. And so in this scenario, typically what's recommended both by American College of Obstetrics and Gynecology as well as the Society of Maternal Fetal Medicine, they actually advocated for women to be included in the trials, although they weren't. But they do advocate that women be able to be given the choice to get the vaccine, especially if it's their turn, knowing the risks and benefits of, what their risk of contracting the infection is, and knowing the risks of what we know about the vaccine right now, too. So again, it's important. It is a personal decision and a decision that you can certainly make with your OBGYN as well. But I find that it's very important, especially for women who are in these high risk categories, being able to get that chance. And many women are getting the vaccine also while pregnant. And just like with the safety, even though we do a lot of safety trials before and as the vaccine is getting developed, these folks are still followed going forward. And usually, even once a vaccine is completely FDA approved, there are still years of safety studies that go on going forward to make sure that we do catch anything if there is any abnormality or issue with certain patient populations.
And we've gotten a lot more specific questions from people. I've had at least 2 people write in to say, I have multiple sclerosis. Should I get the vaccine? Other people with immunocompromised conditions. I've seen people ask about Bell's palsy. Other people ask about certain complications that have happened rarely with vaccines in the past, Guillain-Barré syndrome. Is there any general advice for those people who are worried about complications that even admittedly might be very rare?
Great question. And again, a lot of these societies for specifically a lot of these conditions have come out with statements. And really the main statement is that these folks should still be offered the vaccine. To date, there's been no issues or no relation between Guillain-Barré syndrome and the Moderna or the Pfizer vaccine. And even folks who've had Guillain-Barré syndrome from prior vaccines as well, it's not necessarily a contraindication, although you can certainly talk to your provider. Similar to, you mentioned some immunocompromising conditions, so multiple sclerosis. There's a variety of other immunocompromising conditions as well, folks that are on certain agents that may make them also immunocompromised. Again, conversations with your provider, but we know that in a lot of these immunocompromising conditions, folks can have a severe course with COVID-19. So getting vaccinated actually against COVID-19 is recommended currently. But again, personal decisions, conversations with your primary care doctor or your specialist, because it's important to always make sure we weigh the risks and benefits to what we know will happen if someone could get infected with COVID-19 and what can be the complicating factors, whether it's a prolonged ICU stay. Obviously, we've seen deaths. We've been over 400,000 deaths across the United States. So it's important for people to understand that risk-benefit ratio.
Yeah, and before we get back to Dr. Hussain, I want you to talk just a little bit more about that quickly. Do you feel like when people are trying to make this decision, they're not really weighing the risks of both COVID-19 against the risk of the vaccine, and instead just sort of hyper-focused on the vaccine itself, and therefore maybe not making the most informed choice?
Yeah, I think that's certainly part of it. We get scared that we're talking about novel technology, although like Dr. Hussain mentioned, this has actually been studied for decades. It's just behind the scenes and we never really heard about this prior to. But we've had lots of scientists and vaccinologists, et cetera, doing so much work beforehand for us to be able to have the vaccine at hand right now. And I do believe that sometimes people get a little apprehensive with this new technology and then automatically assume because it's new, it's going to cause, a lot of issues. And all of the vaccine trials, even before it can be FDA approved or emergency use authorization approved as well, have to go through at least 2 months post folks receiving their vaccine, so that we catch if there is any abnormal side effect, reaction, the anaphylaxis, et cetera, because that's the time frame when we're going to see issues related to vaccines.
Yeah, the anaphylaxis, if you're not familiar, being a very severe allergic reaction. Again, Dr. Abrantes-Figueiredo, thank you. We'll get back to you in a second. I just want to move over to Dr. Hussain now to do a little primer for people who have heard this term herd immunity. We've heard a lot about it, but I don't know that it's always the easiest thing for a lot of us in the media to explain what it means and what it is going to take us to get to that threshold. Can you start with that?
Sure. So herd immunity basically refers to the concept that either through vaccination or through natural infection, everybody has an immune system and immunity developed against a particular pathogen. In this case, we're talking about COVID-19, so that the virus cannot really infect anybody and doesn't have any host. So it peters out. And different diseases, different conditions have different thresholds for herd immunity. So it's hard to, from the CDC perspective, they don't really give us a number, but we have experts who've said, anywhere from 80 to 90% of the population needs to be vaccinated in order to get to that level. So we, as you know, we have a way to go before we get to that point. Also, Tim, if you don't mind me jumping in real quick, I just want to chime in from the earlier question related to pregnancy. So in the Pfizer trial, I want to share with viewers that there were women of childbearing age that were included in the study, and there were 23 women who did become pregnant during the course of the trial. Only one of them lost a baby, and that was in the placebo arm, not the vaccine arm. One other thing I want to add, related to the Moderna study. So when it was looked at rats, gestational rats who were about to have babies, it was safe. There was no concern related to how those rats, in terms of their babies, were developed. So it's important for folks to remember that, and as well as it's not a live virus.
Right, yeah. In fact, there's no real part of the virus initially at all other than what your own body is making in the first place, which is still mind-blowing to me. Okay, back to herd immunity. Yeah, that seems like a very high threshold, which I'm guessing is because this is so contagious. It can spread so easily. But you mentioned before a very good point. It's a combination of people who get vaccinated and people who have developed natural immunity from getting the disease anyway. Do we have any idea at this point, any good estimates, what percentage of Connecticut's population appears to at least have some natural antibodies to COVID-19? So at least it's that many fewer people we absolutely would require to have to get the vaccine?
It's hard to say, Tim, but what we know is we're working on the assumption that we would need to get 80 to 90% of people vaccinated. And it's our, forums like this will help viewers understand the importance of the vaccine, and we're there to answer their questions, whatever they may be.
And of course, a lot of people are very hesitant about getting the vaccine. Is it safe to say that if we do reach that herd threshold, even these people who choose not to get the vaccine for whatever reason, they will get some degree of protection because of the herd immunity itself?
Probably yes, but I would, again, advise people to look at the data, look at the science. It's important that we all, get vaccinated. And one point I want to point out, Tim, even in individuals who have had infection in the past and they have natural immunity, we've seen cases of reinfection. We know natural immunity does not really last. It varies. It does not last as long. So the CDC recommends, even if you've had an infection with COVID-19, you are a candidate to get vaccinated.
That is a very good point, and I'm glad you made it, Dr. Hussain. Okay, on to the next question. One more for you before we go back to Dr. Abrantes-Figueiredo. A question a viewer wrote in saying, I've heard this kind of vaccine will alter my DNA or give me cancer. Is that true?
No, it's not true. It gets degraded very quickly, as I said earlier, by the body. It does not enter the nucleus, and it does not interfere with the DNA of our body or our genetic makeup.
Okay, and that's pretty much a full stop to that. There's no yeah, ands, ifs, or buts. Dr. Abrantes-Figueiredo, another question came in from a viewer saying, is the vaccine safe for children? If not, how do we protect kids against the virus?
A great question. So this was another group of patients or study subjects that were not included in the studies, although originally in the studies, I should say initially, although Pfizer was recommended for 16 and over because they did later on start to include children. So we don't have the full data set on this, but there's ongoing trials to start including folks or children, I should say, of younger ages, 12 and above, and then there's been studies that have started for 5 and above as well. Again, similar to pregnant patients, these are vulnerable populations that get excluded from trials early on. So there's ongoing studies to make sure that it would still be safe in children. How do we protect kids right now, especially if they can't be vaccinated? It's all these important things: wearing a mask, watching our distance, washing our hands, that are still so critical and still so important. we've seen that it works. We have a lot of schools in Connecticut that are open and able to stay open without any significant outbreaks because of the measures that they're using within the schools as well. Another big thing, since I'm mentioning that, is to say that even after vaccination, because we're still doing it so staggered and we don't have the data or the 80%, 90% immunity, we still need to continue masking and watching our distance. After I was vaccinated, I have not changed anything that I do. I still wear a mask around folks, still watching my distance, limiting my time with other people, etc. Trying to not be in enclosed spaces with folks who are not in my family pod, I guess you can say, still wearing full protection with patients in the hospital as well, too.
Okay, I want to pull up some more. Hopefully we have some graphics we can pull up. Otherwise, I can just go to some of the questions we've gotten. Do we have any sort of full screen graphics of viewer questions? Okay, yeah, let's pull up some of them and see if we can answer them as they're coming in. So just give us a second for that. Here is one. Okay, we hear about people in the general population getting vaccine shots, but why don't we hear about patients in the hospital suffering from COVID-19 getting this vaccine? Is it not effective once one is hospitalized? That's a good question.
A great question. So a vaccine is really a preventative measure from infection or disease. More specifically, disease meaning an infection that's causing symptoms and other manifestations as well. So really with our patients who are presenting who are positive, there's other recommendations that we would use. There's other treatments that we use for infected patients. But like Dr. Hussain mentioned earlier, these patients would still qualify for getting the vaccine after they've recovered from their illness as well, but it wouldn't necessarily be given while they're in the hospital.
Okay, and this next question for either one of you who wants to jump in, it's coming from Rob in East Windsor, who wrote in to say, under Phase 1B, there is a listing individuals between the ages of 16 and 64 who have comorbidities. However, qualifying comorbidities are not listed, and I was unable to find them on the website. Do you know what the qualifying comorbidities are in order to receive the COVID vaccine under Phase 1B?
So that list is still pending, but will be definitely looked at by both DPH, the Connecticut Advisory Committee as well. There are a lot of comorbidities, or should I say, diseases that patients may have that place them at risk for severe COVID-19. So the list may actually be quite exhaustive. So there will be work in doing or trying to risk stratify patients or community members as to what makes it the highest risk, so that we have an actual list to be able to provide patients so that we then know which ones will qualify for the vaccine.
Yes, and it just illustrates that this is still very much a work in progress. Thank you so much. All right, next question. Diane wrote in to say, can you be more specific about people with allergies receiving the shot? I have seasonal allergies and sinus problems. Also, I am sensitive to some medication as far as getting one or more of the side effects.
Great question. So I can take that one too. And so with routine or sinus allergies, those are not contraindications to getting the COVID vaccine. And like I mentioned before, the only contraindication is to have a specific allergy against any of the components in the Pfizer or the Moderna. And what's thought is that it's likely the PEG or the propylene ethylene glycol that's within that vaccine. That being said, folks who may be, nervous or anxious about their history of allergies to certain agents can certainly talk to their specialist to kind of also ease some of the concerns. And again, really, even folks who've had anaphylaxis against a prior vaccine, while there maybe need to be some caution with getting the COVID vaccine, it's not a contraindication and something they can easily speak to their specialist or their allergist about.
And you know what, that's great because we already had a different viewer, Rochelle, asking that question if you've already had an allergic reaction to a vaccine in the past. Can we go over really quickly before we get back to Hussain, Dr. Hussain, just some of the side effects you can expect possibly once it's your turn to get vaccinated?
Sure. So a lot of them are common side effects that we see with almost all vaccines. So sore arm, you can have redness around the injection site as well. For both trials, typically the more prominent symptoms were seen after the second dose. And in those cases, people can have muscle aches, fevers, chills as well. One really important thing to point out is there are certain symptoms that should not be attributed to the vaccine and would prompt someone to need testing for COVID-19. So loss of taste or smell, shortness of breath, cough, respiratory symptoms similar to those would want someone to then speak to their provider so that they can get tested for COVID-19.
Okay, thank you so much. All right, Dr. Hussain, I know we've talked about the mRNA that's in the vaccine, but a good question from Annabella, who asked on Instagram, overall, what is in the vaccine? What else is in there?
In the vaccine, it's minimal. So it's the mRNA and fat known as lipids that make the mRNA enable the mRNA to get into the body and into the cell, so it's not destroyed. Like I said, it's very easily destroyed by the body, and that was one of the challenges that led to us looking at various techniques and why it took so long for this technology to be deployed. But there's very little, and I agree with Dr. Abrantes in terms of the specific contraindications from a CDC perspective is only to PEG, polysorbate, and if you've had an anaphylactic reaction to the first dose of either the Moderna or Pfizer, then it would be a contraindication. But all other folks that have had severe allergic reactions in the past to other substances, medications, peanut allergy, food allergies, latex, whatever the case may be, we observe those individuals per CDC guidance for 30 minutes post-vaccination instead of 15.
Okay, thank you for that. Again, we said Rochelle on Instagram, you already answered her question about reactions in the past. Lisa on Instagram wrote in to say, how much coverage do you have from COVID once you get the first shot? And of course, we're going to say, make sure you get both shots. But that's been a topic of concern from some people as far as what the first shot gets you and when.
So it's important we follow what the science tells us and how the trials were designed. They were designed as both Pfizer and Moderna vaccines were designed as a 2-dose vaccine. And we know from data that from the Pfizer trial that the efficacy, immunity was probably around a little over 50% in the weeks following the first dose. It takes 10 to 14 days before immunity kicks in after the first dose, and similar time period after the second dose. But it's after the second dose for both Moderna and Pfizer that it's in the 95% range. And that's where we want to really be if we're going to be making an impact and a dent and end this pandemic.
And I don't want to put you in a sort of an odd position to give blanket advice here, but this is a question we're getting more and more, especially since people 75 and older are starting to get these vaccines, and they want a little real-world advice. And they're saying, how long after the point that I get the second vaccine? I know you still should be social distancing and wearing a mask and washing your hands, but if after you've gotten both doses, you want to take a chance and finally hug your grandkids again, or give them a kiss on the cheek, or maybe just have them over for one dinner and take a measured risk, at what point would you say that might be okay? Are you comfortable answering that?
Yes, I am. And that's a great question because that's a scenario that's going to play out across homes and cities in this country. So again, we've sacrificed so much during this year. So it's a little bit more, well, everybody else gets vaccinated. So it's important to remember the bubble concept here. So if the grandparents have been vaccinated and it's been 2 weeks after the second dose, that's when, like I said, immunity kicks in. It's important those children or those grandchildren, no matter what their age is, they're also vaccinated. And you're just like how we advise with quarantine. If you're going to be spending time with someone, you need to go through that 14-day quarantine period to ensure that you can form that bubble. It's the same advice. So because we don't want the grandparents, for instance, to transmit something or the children to transmit infection without everyone being vaccinated. So it's a little bit longer that we will need to continue to sacrifice till everybody's in the same boat.
This is the last question I want to ask. I think maybe you can take it, Dr. Hussain. But before we knew that there were new, more contagious variants out there and the possibility that they could be starting to spread, it looked like some of the predictions were that maybe starting 2 to 3 weeks after the new year, maybe that's when we hit a peak. And sure enough, the positivity rate, the 14-day rolling average, has been on the decline now for 8 days. Hospitalizations never did get too far over 1,200 in this latest range. There are at least some early signs that there's a plateau happening in this wave. Do you think it's too early to make any predictions that that is going to happen? And just how much do we still need to be worried that a more contagious variant could show up in Connecticut, blow the whole thing up, and give us a third wave on top of what we already have?
So, Tim, to be honest with you, that's the exact scenario that keeps me up at night. Yes, the trends are encouraging, but they're early trends. We know the B117 variant, that's and otherwise known as the UK variant, is in this country. We know there have been cases in Connecticut, for instance. We don't want to be where the UK is now, where they're 70% above what their levels were in April. And so we can learn from other countries. And it's important that folks don't let their guard down as we get through this vaccination process. We look forward to working with the new administration and the 100 million in 100 days. But it's important that social distancing, masking, and practicing hand hygiene continue hand in hand.
And just to reemphasize that, Dr. Abrantes-Figueiredo, why is that so necessary after you get vaccinated if these vaccines work so well?
So it's still so necessary just because we're clearly staggering vaccinations and we can't vaccinate everyone at once. And the other thing, like Dr. Hussain and Tim, you mentioned too, we have now the UK variant to deal with, and it's estimated that, well, not estimated, it's already here, but it is estimated that it potentially has, the capacity to see alarming numbers in the United States in March. So our goal is to use everything in our toolbox to make sure that we can try and end this pandemic. Vaccine is just one part of it, and we have to continue everything else that we're doing so that we can truly end the pandemic, and so that we can truly, grandkids, parents, folks like that, being able to visit friends, family, and hug without having that fear.
And one more thing, Tim, if I could quickly add, sorry, oh, okay, great. So one other thing folks need to remember is, especially those that have been vaccinated or getting vaccinated soon, and the question that we get is, okay, can I stop wearing masks and, or not practice distancing? It's important you do, because what we know from these two studies, we know these vaccines are great in terms of preventing clinical disease, especially severe disease. What we don't have answers to from both Pfizer and Moderna yet is can somebody who's been vaccinated become an asymptomatic carrier? Can they still get infection and transmit it to other people? So we don't have the answer to that. That's why it's important that folks continue to mask and distance.
That's very good you mentioned that, because that's, I think, the most prominent comment we've been getting during this Facebook Live. And a thank you to Shannon out there. She wanted to know just why, why do we not know that sort of thing? But let me approach that from a slightly different area, because I know we don't want to make any predictions about something you don't know for sure regarding how contagious a vaccinated person will be. How often has it been in the case with other vaccines in the past that a vaccine would provide this level of protection that we know the COVID-19 vaccines can provide, and yet still people wind up being contagious? I mean, is that a common occurrence, or is that very rare and we just don't know if this might be that one time out of 1,000?
So typically it would be less common. So, ID experts around the world, and obviously this is continuing to be studied, that likely because it can prevent clinical disease, that likely it should help to prevent asymptomatic spread as well. That being said, given we're in a pandemic and there's still so many unanswered questions, especially without the studies being completed, it's so important for folks to continue the masking even after being vaccinated.
Yes, especially because it doesn't require all that much on the part of all of us. Wearing a mask is not a big pull. It's not a big ask, especially after 10 months now of doing it. And yeah, I'm glad you both also brought up the point of how good this is at preventing severe disease. As far as I knew, in the clinical trials of the people who actually got, outside of the placebo arm, who actually got it, I think there was only one case of severe disease in 30,000 people, essentially a 100% success rate. Is that still what we're seeing out there, Do we have any updated numbers on that?
I don't know if we have yet updated numbers, but Pfizer and Moderna are continuing their studies as well, and to give out prelim data as it comes out. But that's the important thing that folks need to understand, that even if some folks still became infected, it prevented them from getting severe disease, which obviously it's the severe disease that we're so worried about, considering folks have prolonged hospitalizations, prolonged ICU stays, obviously, ultimately, potentially the possibility for death. So it's so important for folks to understand that not only being able to prevent infection, but then that severe disease is so crucial.
It is. Both of you, Dr. Hussain, Dr. Abrantes-Figueiredo, I know a lot of the questions that we have asked you on behalf of our viewers, you've answered and answered again and answered a third and fourth and fifth time. But that's just all part of getting the message and getting the truth out to people out there. So thank you so much for taking the time to offer your expert advice. You, too, can answer these questions in a way that obviously we can't. So thank you so much for taking the time to talk to our viewers directly like this.
Thank you, Tim.
Thank you so much.
Thank you both. And thank all of you at home for watching this Facebook Live. Keep the questions coming. We have Dr. Hussain on the Fox 61 Morning News with us just about every Friday morning, and I believe he'll be joining us again tomorrow. And remember, you can also find more vaccine answers as well as a step-by-step guide on how to sign up for a vaccine appointment through the state or through one of the major healthcare providers. All you have to do, text the word vaccine, that's VACCINE, to this number, 860-527-6161. And be sure to tune into the Fox 61 News at 4 and 5 later today. So stay safe, stay healthy.